I'm very, very happy to be here. I'm also very happy to be interrupted. So if you have points of clarification or something that you'd like answered at the moment, then I'm very happy for that. What I thought I would do is present a little bit about the International Multidimensional Poverty Index and then a little bit about the Mexican case. And in each case, try to talk a little bit about how these measures might influence or inform policy and planning exercises. But also, in the course of doing so, just explain the nuts and bolts of what we've tried to do. This is work in progress, and it will need a lot of hands to make it actually useful. So many other ideas are very welcome. I begin with our motivation. The Oxford Poverty Development Initiative, where I am, as well as I think DPU, many of us are informed by the work and writings of Amartya Sen, who understands poverty to, in a sense, be inherently multidimensional because people's lives are battered and diminished in all kinds of different ways. And so the job, in a sense, when we come to something as tedious as measurement, is trying to make a measure reflect a little bit better the fact that a woman must lock her door, worry about feeding her children, worry about going and what she will work, what work she will do in the day. There are multiple challenges and disadvantages that people experience. And so this obviously needs to inform our measurement work. The International Multidimensional Poverty Index was calculated by many people. And there's a whole team in different countries. The youngest was 20. We didn't realize that when we hired him, but he was fantastic. Juan Pablo Campo, based in Universidad Pacifica in Peru. And so a number of people have been responsible for this work, and also for the ground reality check, the more qualitative work, which helped us to see if this had any sense in their communities. My colleague John Hammack is also here from OPHI. The MPI is a measure of acute poverty. It's not of wishy-washy, but it's really quite acute deprivations. It was launched on the 14th of July and is in the 2010 Human Development Report as an experimental series that replaces the Human Poverty Index that Sabina and Amartya Sen had developed and that had been released in 1997. The reason is that in 1997 they did not have the data nor the methodologies, but primarily the data that would have been required to do a more demanding index that looks at each person. And so part of the reasons that this work has come out is that we now have more data than in any time in history, although we will complain very vocally about its limitations. It'll be updated. We are now doing the MPI 2011. We'll do one, if we can get the data, for middle, high, and very high human development countries, which is less acute and more relevant in Eastern Europe, Central Asia, in OECD countries. And analysis and improvements are ongoing, and there's a lot still to be done, so all hands on deck. And our aim in this work also, I moved some slides too quickly, I don't know how to go back, was to develop better national measures. And that's why we'll close with Mexico and one example of a national measure, because national measures can carry the context, the melody of the country much better than an international poverty measure can, although it will still be limited, particularly if the countries are very large. So just to run through the basics, the Multidimensional Poverty Index uses data from 3 primary international sources: the DHS, or Demographic and Health Surveys, the Multiple Indicator Cluster Surveys by UNICEF, and the World Health Survey for 19 countries. 48 of the DHS, that's the best quality of data by far. We use 2 special surveys, one for Mexico and one for urban Argentina. My co-author on this work, Santos, is based in Argentina. And Argentina is the only country for which we don't have nationally representative data. It covers 104 countries. In terms of population, we have 94% coverage in sub-Saharan Africa and South Asia, down to 60% in the Arab states, but there is some coverage of different regions. It covers a total population of 5.2 billion people using 2007 population figures for every country. Now, in creating a multidimensional poverty measure, you have to be very concrete. and you have to choose dimensions and choose indicators. So the MPI has 3 dimensions: health, education, and standard of living. Those are the same 3 dimensions as the Human Development Index, which is a welfare index rather than a poverty measure. It looks at everybody, not just the poor. And so it borrows on that. They are also, unfortunately, the only dimensions for which we could get data for over 100 countries. And we tried very much to include empowerment and to include work. Because there were some questions related to those. And we also wish to include safety from violence and something about relationships. The reason is that these dimensions, when you go into poor communities, are, in many different regions, are mentioned as aspects of deprivation or poverty or of their aspirations towards well-being. But we do not have comparable data for them. And so alongside this measurement project is really a call and appeal to the international agencies and to country governments to regularly collect data on the missing dimensions of poverty, so that our measures of poverty again can come closer to poor people's experience. I will show later on that DRC and Madhya Pradesh, a country and a state within India, have about the same multidimensional poverty. That would not be the case if we could include violence, where DRC has much higher levels. Oops. And if we go back to Bhutan, Bhutan's Gross National Happiness Index has 9 dimensions, just to show you. 8 of them are replicated in the Sarkozy Commission on economic progress, economic performance and social progress that was chaired by Sen, Stiglitz, and Fitoussi. And many countries, when they go wider to looking at well-being, would include some non-traditional dimensions. So there are 3 dimensions, and there are 10 indicators. And literally, again, these are about the only 10 indicators for which we had data for more than 100 countries. You are deprived, not yet poor. I'll talk about poor later. You have to be deprived in a few things to be poor. You are deprived if anyone in your house is malnourished, for whom we have data. You are deprived if a child has died. We don't know the age of the child. We don't know the time of death in some surveys. You are deprived if nobody in your household has 5 years of schooling. You are deprived if one school-aged child, any school-aged child, is not attending school. This should be a school attendance, not enrollment. Years 1 to 8, where you use the national starting ages. And you are deprived if you use wood, charcoal, or dung to cook with. If you do not have adequate sanitation, by our closest approximation to MDG measures, or if your sanitation is shared. You're deprived if you don't have clean drinking water, or if you have to walk more than 30 minutes to get it. You're deprived if you don't have electricity, if you have a dirt floor, and if you don't own a car or truck, and if you don't own more than one of the following list: telephone, television, radio, refrigerator, or bicycle, or motorbike, actually. So what we do, in fact, is from each survey for every household, we can see what deprivations that household faces. And so, in a sense, for every household, we have what they are deprived in, and therefore what each person in the household is deprived in. Again, we wanted individual level data so we could look at gender issues, intra-household inequalities. We do not have it. So that's the raw ingredients of the measure, as constrained and imperfect as it is. What I'll do now is describe the weights and then the methodology. The weights are visually apparent here. Health and education and living standard are equally weighted. This is also done in the Human Development Index, and there is now a literature around those equal weights because it was very controversial when those came out in 1990. A literature asking experts, so-called experts, how they would weight them. A literature on robustness showing that 92% of country rankings would not change if the weight on any HDI dimension was between 1/4 and 1/2 instead of 1/3. But also, for policy purposes, we use equal weights because it's easier to understand, and the measure's purpose is not to please economists, but to change policy. So Tony Atkinson, in his book with Eric Marlier and Cantillon and others, said the interpretation is easier when the dimensions, the components, have roughly equal degrees of importance. And so that being a motivation for this measure informed our choice of weights. Each indicator is also equally weighted. And as you can see here, visually, there are 2 indicators for health and education and 6 for assets. So their weights are 1/6 for the top 4 and 1/18 for the bottom. The math here goes up to division and multiplication, but not beyond that. Okay, I mentioned that if you are deprived in something, it doesn't mean you're poor. You might not have electricity, but you might have a generator, you might have other ways of getting your needs met. You might have a low body mass index, but you might be a fashion model. You might cook with wood, but then perhaps you have a chimney in a separate kitchen. So any single indicator, particularly with the very rough and ready data that we have, may not reflect poverty. So what we did is said, we will identify you as poor if you are deprived in at least 30% of the weighted indicators, of the dimensions. That means 2 health and education indicators, or all 6 asset indicators, or 3 assets and any health and education indicator. Okay? So that's new, that's not been done in this way before, although there had been a tradition both in Swedish level of living and in the unmet basic needs tradition in Latin America of going in this direction. So any person who experiences 30% or more of the weighted deprivations is poor. And then we create a measure which requires multiplication. The H, or the head count, is the percentage of people in that country who are deprived in 30% of the dimensions. Okay? So it's the head count. I'll explain in a little bit why that's an insufficient measure. And then what we do, which is new, is we multiply this by the intensity, which is the percentage of indicators on average in which all of the poor people in that country are deprived at the same time. The simultaneous deprivations that face you when you wake up in the morning. So it's a simple product, and this is based on work that I've done with James Foster, who did the Foster-Greer-Thorbecke methodology. The measure therefore satisfies, as you might expect, lots of axiomatic properties, being decomposable by subgroup and by post-identification by factor, and satisfying the normal properties of poverty measures translated into the multidimensional context. And it's also elegant in that if you think of it as a matrix, it's simply the mean of the matrix. So we set this up as a matrix where this is important because each person has their own row. And I'll show a picture of this rather than numbers in a moment, but each person has their own row. We know if they're deprived or not. We know their average intensity, and it's based on each person that we build up a national measure. And that's why we can break it down in different interesting ways that I'll try to show. But let's move to people. This is Tabitha. She lives in the Lunga Lunga slum outside Nairobi. And she's one of the many MPI deprived people, MPI poor people, who informed this work in our ground reality checks. She's a washer person, and she and her family live on less than $1 a day. She earns 66 cents per wash, and has 4 children. If she can't find washing that day, she sells recycled cloth. So she goes to her place of work, and other colleagues do the similar kind of work, and tries to look for cloth that has the potential of being reused. And if she can find it, she brings it home and de-threads it. And she earns 15 cents per kilo and can de-thread 1 to 5 kilos a day. So we know that she is income poor. But knowing that, if income poverty is our only measure, we do not know other things about her life. So if we take a multidimensional perspective, we also find out that one of her children is malnourished, that she has to buy and carry her water. They have to pay to use the group toilet, 7 cents to do so. They don't have electricity, and she doesn't own more than one asset. So I've turned the other thing on its side, but she's deprived of nutrition and in 4 of the asset indicators. She's poor because she's deprived in more than 30%. She's actually deprived in 39%. She's less deprived than people on average in Kenya, who are deprived in 50% of our dimensions. And there are many such people who influenced us, for example, about the importance of looking at charcoal as a cooking fuel. In terms of approaches to poverty, what's new is that we look at the people first. We only focus on the poor people. We censor, we ignore everybody who's deprived only in 10%, 20%, all the fashion models, all the illiterate self-made millionaires. We screen them from the data set. We censor them out. All of the data that maybe suggests deprivations that others don't know. From a capability perspective, also, if some deprivations might be willingly endured, then this gives people scope to do so. And this gives it, I guess, a difference. And in terms of the literature, it's looking at the joint deprivations that people are, or coupled deprivations that people are enduring. So that's what's new. And the intensity measure, which I'll show in a moment, is a signal of that. So what I'll do is present quickly 6 of the findings, but quite quickly, from the international measure. I'm afraid I only brought 35, but there are a few briefings on it over there, 35 of them, so you're welcome to one. First of all, there is and has been since 1990 a global measure of poverty, which is the $1 a day, which became $1.25 a day. How does this compare? Is it saying the same thing? If so, we may not need it. So this is a comparison. Every country is lined up from Slovenia and Slovakia, in which nobody was deprived by this measure, to Niger, our poorest country, in which 93% of the people were deprived or poor, according to our measure. So that's the colored bars. And the black points are the percentage of people who are income poor by the $1 a day measure, the $1.25 a day measure, for the latest year for which we have data. And what you can see is that there's a general relationship. Generally, the poorer countries in income space and in multidimensional space go together, and the less poor together. But you also see the relationship is jagged. This is Ethiopia, in which 39% of people are income poor. This is Tanzania, it's 89%. And the multidimensional MPI poverty is quite different. We don't know why. We need to explore it. We need help exploring it. It's a question. Part of the reason is also data issues. These do come from different years, and we will be updating the MPI every year from this point on with data that emerges in that year. But the base years are different, and we do not interpolate. Second finding, most poor people live in South Asia, followed by Sub-Saharan Africa. So the 104 countries cover 5.2 billion people. 1.7 billion of them, which is 32%, are MPI poor according to our measure. And of them, 51% live in South Asia and 28% in Sub-Saharan Africa. The proportion of the world population is up there, and both regions have, in a sense, almost the same proportional increase in their carrying capacity of acute multidimensionally poor people. We do that because often the MDGs focused on the number of countries that were in progress, where India counted as 1 and Maldives counted as 1. And that devalues the lives of every Indian by 3,000 times compared to the lives of every person in Maldives. So we really wanted to drive attention to the people, because each poor person we thought should weight equally. So we've done the population figures this way. A third question is, well, how does the number of people relate to the intensity of poverty? So what we've done is put the countries in the same order as before, Slovenia and Slovakia up to Niger, according to the percentage of people, their head count of multidimensional poverty. And the height is the intensity of poverty on average that a poor person in that country endures. And in a sense, this is a sad story, because what we find is that almost counterintuitively, in the countries that have the most percentage of people multidimensionally poor, the poverty of each person is most intense. Okay, and we didn't expect this, and again, we're trying to understand why. But Niger, 93% of the people are poor, and we thought, well, maybe they're a little bit less poor than in other places where they're deep pockets. But instead, we find the intensity is the greatest. Also, the countries are colored according to their income status, with the maroon or brown being low income, the beige lower middle income, and the green upper middle income. And this is, in a sense, a message both of hope and despair, depending where you live. In terms of the brown countries, you see they spread from here, Uzbekistan, with 2% people in poverty, to 93. So countries with a low income can get acute poverty down. It can be addressed even with very limited fiscal resources. That's been something that the human development community has stressed a lot in terms of the HDI, and we find it also in poverty. But the green countries, the upper middle income, are also, these are green, though you can't see them very well. So there's some upper middle income countries with higher poverty than low income countries. So your GDP per capita may not predict very well the status of the acutely poor people in your society. The fourth is that the MPI varies a lot, and we can decompose it, if the data permit, by anything. By gender, age, ethnicity, religion, orientation, whatever one would wish. Here, the data only permit ethnicity in some countries and states in some countries. So, for example, this is a decomposition of India. Kerala has only 16% of its people multidimensionally poor, Bihar 81. We also did a figure which was a bit disconcerting for India, which is to show that the poorest 8 Indian states are home to more MPI poor people than the 26 poorest African countries. So I'll go through that really quickly. The MPI varies from 0 to 0.64 is Niger's MPI, and those have 0. So we took the midpoint, which is 0.32. And we looked at all countries that had an MPI greater than 0.32. Oops. All but Nepal were in Africa. And then we looked at India, which was that huge bubble. The size of the bubble is the population. 1.1 billion people. And we wanted to break it apart. Because the population of India is actually one country greater than the population of the sub-Saharan African states. And so we wanted to explore the internal diversity. So we decomposed the states by MPI and looked at those Indian states whose MPI is greater than 0.32. To the distress of many friends, Amartya Sen's family home is in West Bengal. West Bengal was among them. What you can see is that the green countries are African and the orange bars are Indian states. The poorest countries or the poorest units are still in Africa, though the populations are small. We can't break these down anymore legitimately. Though Ethiopia is huge, but the Ethiopian data are wrong because they're too old. And so we will update them with the 2008 data this year. And that will go down as Ethiopia has made a lot of progress on these indicators. So you can see that there actually is quite a bit of dispersion among the countries and the states. And then if you look at population and the same thing, the percentage and the intensity, you can see that the states like Bihar have the population equivalent to Ethiopia, or DRC, as I mentioned, has a population equivalent to Madhya Pradesh, both about 70 million, just under. And the MPI actually of DRC and Madhya Pradesh are exactly the same to 3 numbers of significance. So we can break them down and compare Madhya Pradesh and the Democratic Republic of the Congo by dimension. And so we see all of the 10 indicators here and their percentage contribution to multidimensional poverty. You cannot do this if you only use the head count. This is why we have to use the intensity and every person's data, because otherwise you can't get to this analysis. And this is important for policy because it shows in my state, in my region, in my ethnic group, what is driving poverty. So in Madhya Pradesh, malnutrition is much more of a driver than in DRC, and health in general is more prevalent as deprivations among the multidimensionally poor, whereas child enrollment, school attendance, and the electricity and water are more prevalent in DRC. So this should not be read off, we were talking about this earlier, directly onto the budget, because we have to analyze the interconnections between dimensions. Unfortunately, a lot of countries are trying to read this into their budget right now. But it can inform a kind of analysis about what are the coupled deprivations that the poorest of the poor are experiencing. Talking about poorest of poor, the final kind of decomposition we can do is to break it down by intensity. So we broke it down by subgroup, we broke it down by dimension, and then we can look who's deprived only in 30 to 40%. Who's deprived in 90% of those indicators? And where do those people live? Where do they call home? What is their characteristics? And so here's India, Cameroon, and Kenya. They basically they're adjacent in our ranking. They have MPIs that are about the same. Their intensity is different. Cameroon has the average intensity is the highest, and Kenya's is the lowest, although it has the highest MPI because of its prevalence. But you can see that the percentage of people who are deprived in more than half of the indicators is greatest in India. And the percentage who are deprived in more than 90% is greatest in Cameroon. So when these measures are used for targeting, as some countries, including Progresa, Oportunidades in Mexico, are beginning to do or explore, they are able to say, well, our government budget will support 18% of the population. Who are the poorest 18%? And where are they? How do they live? And this can be a useful tool for that kind of work, going beyond and within the poor yet further. And the final thing is we can show change across time. If I can tell you candidly why country governments are interested, it's this point. They want credit for what they've done. And if they put a kid in school, think of the lag between the time that kid goes to school and the time she gets into the workforce, gets a job, and increases the GDP per capita of the country. The income poverty is not going to go down during my political term of office. What I want is to see school enrollment go up so I get credit. And this is very much being an evident incentive to the policy makers in countries that are adopting these measures. So here are 3 countries: Bangladesh, Ethiopia, Ghana. Ghana reduced poverty the most. Ethiopia the least. Again, we will have new data for Ethiopia soon. We can look at how they reduced it. Ghana and Bangladesh reduced it mostly in the green way by taking people who were poor and making them non-poor. Whereas Ethiopia focused on the poorest of the poor, making them less poor, reducing the intensity of their poverty, although they remain poor. So they reduced the intensity of poor people more. Oops. And then we can look to see which indicator. And again, if you are working in government, you want your ministry to be profiled here. Bangladesh, the education was very happy because it was school attendance that drove Bangladesh's success. In Ethiopia, it was nutrition and water. And Ghana had quite a balanced progression across. This is also important for planning, in that the question is, how did Ghana do it? How did they have an integrated approach? Did they? But how did they make progress on all these dimensions within a short time period? And finally, as anything, we are criticized by our friends, and there's been quite a lot of controversy about this measure. And one of the really good questions that was asked, and that we've tried to explore even before we released it, is how robust it is. Basically, you and I disagree. We disagree what poverty is, we disagree on the weights, we disagree on the indicators. Colleagues I love think we should use stunting, not weight for age, as the indicator for nutrition, with very good reasons. And so one always has to make a decision and isn't quite sure if it's the end of the world if you decide on this indicator rather than that. So we ran this through a series of stress tests, in a sense, to see how sensitive it was to different decisions that we weren't sure about. The choice of indicator, water, what if you had a toilet? What if you used drinking water piped into your home? What if the toilet, you didn't care about sharing toilets? Deprivation cutoffs, again, what if they were different? Poverty cutoff, K. We said you're poor if you're deprived in 30%. What if it was 20? What if it was 40? We found that 95% of the country comparisons were exactly the same if we took anything between 20 and 40. And then the range of weights has been, I think, the most visible as a concern because weights reflect value judgments, and we know that we disagree on values. Sen's approach is to say that because there will be a range of plausibly relevant weights, we should develop measures that are robust to a range of plausible weights. So we said, well, we're weighting each dimension a third. What if we weight two of them a quarter? So health and education are a quarter, and standard of living is a half. And then health and standard of living are a quarter, and education is a half. So what if one by one we give each dimension a weight of a quarter or a weight of a half? How does that affect our results? And we did a number of different tests, which I can go into if you're interested, and found that, again, the easiest is this: 88% of the pairwise comparisons of countries are not changed across this range of weights. Because this is new work, we actually don't know what the limits are. We're trying to work that out methodologically, but at least we're trying to address these issues explicitly, and help is welcome. I'll close on the international just by looking at some policy applications that I've already mentioned and tried to illustrate in the presentation. One is targeting, so identifying the groups or the regions that have the greatest poverty. I'll show that in Mexico in a second. And identifying the deprivations that account for the most poverty in different areas. Interesting, West Bengal and Bihar, states in India, about the same poverty, but very different configurations of it. Bihar being more driven by nutrition, West Bengal by assets. And then, as I mentioned, it shows the impact of policy interventions quickly. You have to make sure that it's not gamed to do so, but no poverty measure is beyond political manipulation. We are not immune from that. One simply has to try to develop standards and robustness tests that will at least reveal it if it occurs. And our hope is to learn from folks who do this how to use this work to design policy that reflects the structure of the measures as well as of the values of the people inside. So I wanted to close just by giving you one example, and I'm afraid my laptop crashed today, and so I don't have these slides in English, but they're Spanish. So this is the Mexican multidimensional poverty measure, which was made public in December 2009 after 2 years of very careful debate, discussion, and construction. And they looked at a lot of things. So they have an explicit account of how they chose the dimensions, of how they set the poverty lines, how it reflects their constitution. What happened in Mexico is that there was a general law of social development that was passed in 2004 that required the country to develop a multidimensional poverty measure. And it actually named the dimensions which are in it in the law. So those were chosen ex ante, as it were. And they also identified each of the 6 dimensions as a right, a human right, a social right. And so when it came to setting cutoffs, they selected the cutoffs that were in accordance with the national law of Mexico. For example, if when I was going to school, the limit for education, the compulsory education, was up to 8 years, I would be deprived if I didn't have 8 years. If for you guys, if it was 12, 16, 12, then you would be deprived if you didn't have 12. So they used their own legal structure rather than a participatory approach to set their own dimensions and indicators and cutoffs. Now what they do is they do a map of society. So let me explain this because it's really simple. So these are the 6 social deprivations. food, housing services, housing quality, education, pensions, and health insurance. Any one of them, it doesn't matter. This is how many you are deprived in. You're deprived in 1, 2, 3. These people have no deprivations in the social sphere. Then that one that I can't reach is the income poverty line. Mexico wanted income weighted at 50%, and so it's in their measure at 50%, and the social weigh 50%. Persons under that line are income poor, and persons over it are not. So they consider people who are to be multidimensionally poor if they're deprived in income and one social dimension. So in our measure, income is weighted at 50%, you have to be deprived in 51% of your indicators. The people above are deprived in social dimensions, but not in income, and these are income poor, but not socially deprived. And the green they call, a very technical term, nirvana. And the objective of public policy is that green area, to get everyone into nirvana. And so they want to map everyone in their society, because as they say, if the black dots are people, it's not the same if you have a society which has a lot of spread versus if you have a society in which there's much less extreme poverty in both income and social spaces going on. So, the final thing that they did was to look at extreme poverty using a lower income poverty line, just the food basket, and looking at people who are deprived in 3 or more of their social deprivations at the same time. So they identify extreme poverty, and then the other spaces. And in Mexico in 2009, a third of the people were in moderate poverty, and 10% live in extreme poverty. What they did for the first time in Mexican history, and this is a landmark, was also to recognize the indigenous populations. By several different ways. I'll show you the language. So they also looked at poverty by age. They looked at youth poverty, elder poverty, working age poverty, indigenous and non-indigenous. And you can see that 39% of indigenous people are in extreme poverty, where it's 10.5 for the nation, and 36 are in moderate poverty. So the percentage of indigenous people who are poor or extremely poor exceeds, 75, whereas for the population, it's 43. So this drew attention to it. They also have poverty maps by state, and as I said, by elder and children. They could not, at that time, again, do gender, and they would like to do that in the past. They also, because I wanted to show a couple examples of policy, they do simulations, and this is controversial. They recognize that this is perhaps a little bit too simplistic, but they do simulations. For example, this is a statistical simulation of what would happen if we had universal coverage of health insurance and social security. How would multidimensional poverty change? So they have a model underneath it, and this is the current poverty with 10.5 in extreme and 33, and this would go down significantly if they were to have full coverage. So countries have these measures. They're countries in all different regions who are approaching us and building national measures. So you'll see sort of a popcorn effect in a bit. But the analysis and their use for planning remains very underdeveloped, and is a region where we need a lot more work. So those are some of the Latin American countries. There are a lot of others. So I'm almost at time. I'm at 40 minutes. So I would like to have more discussion. But this is work, again, not only of me, but of a whole team of people.